Winners will be contacted later. All right. Thank you, Dr. Y and team. Let's adjourn for the next interesting session, which is a special lecture. For that, I would like to call upon Dr. Arasu or Dr. Tirunau Karasu Raju to the rostrum to lead the session. Thank you.
Thank you, sir. Okay. A very good afternoon to Dr. Bhaskar and everyone over here. And I think today for the special lecture, we have a very well-known doctor who has contributed so much for the medical fraternity and also for patients. He is a consultant, interventional cardiologist and physician, iHeal Medical Center, Kuala Lumpur. He was an associate professor of medicine at UPM and Hospital Serdang. He was also the previous head of cardiology unit at medical department UPM. His passion is in early disease detection and prevention. His fields of interest are weight management, heart failure management, geriatric or aged care cardiology, interventional cardiology, and cardiac multi-slice computer tomography. He has spent more than 15 years overseas for his medical training and work. He graduated from University of Melbourne, and then he completed Singapore Cardiology Advanced Specialist Training and was admitted as Fellow of Academy of Medicine of Singapore for Cardiology in August 2004. Here he developed a major interest in heart failure disease management, where he championed a team at Tan Tock Seng Hospital that cared for more than 2,000 patients. There he cared for SARS patients during the worldwide SARS outbreak in 2003. Subsequently, he completed cardiovascular interventional fellowship at the National Heart Centre, Singapore. He is also the fellow of American Society for Cardiovascular Angiography and Intervention. He is not only registered as a cardiologist in Malaysia, but also in Singapore. Yeah. He has played key role in establishing the weight management program in Hospital Serdang. His interest in alternative therapy such as hypnotherapy complements his medical management. He has a certificate and diploma in clinical hypnotherapy from London College of Clinical Hypnosis. So let us welcome Dr. Wong Teck Wee. To you, Dr. Wong.
Thank you, Dr. Arasu. Okay, that's the conflict of interest. So before I start, I want to present a case that I saw recently. This guy is a 74 years old patient. He lives with a healthy 70-year-old wife and a very supportive daughter living about 5 minutes away. He came to see me with an exacerbation of heart failure. On clinical examination, he has a lot of crackles up to the mid-zone. And this type of patient is a very clear-cut indication to be admitted for IV diuretics. But he refused to be admitted because he had been going in and out of hospital over the last 1 year. And he came to see me as a second opinion. So he decided not to do it. And I gave him IV furosemide, a stat dose, and a few other medication for heart failure like nitrates, spironolactone, and Westerel. So after I gave him this medication, he felt better. Even though the lungs has a lot of crackles, but the crepitation improved about 1 to 2 hours in the outpatient. So his past medical history is that he has ischemic heart disease, triple vessel disease. He was referred for bypass, and he has seen the surgeon, but because of the risk of bleeding from diverticular disease and the fear of a major operation, he has declined operation for the last 10 years. So as I said, he has been having recurrent heart failure for the last 1 year. His EF is about 40%. He has high cholesterol and diabetes that's well controlled on medicine, and also diverticular disease. And the heart failure has caused him to have a sleeping problem. And those are the medication that you can see on the screen. But these are the medication that I have changed. So I want to ask you, a patient with a serious problem of heart failure, if you send him home, what are the criteria or resources that you have to provide to him so that he can go home safely? So he refused to be admitted. So what are the home instructions? And what I have told him is that he has to monitor his vital signs. So vital signs, like when you are in the hospital, you measure the blood pressure, pulse, and also or maybe temperature in case he has COVID. And also ask him to be aware of serious symptoms. If there's a serious symptom, I said you have to rush to the nearest accident and emergency to be treated appropriately. So 2 days later, I gave him the instruction that he has to take the diuretics, and he came back to see me on Saturday. So just before I came to Penang, and his condition improved. So what are the prerequisites for home care? So a lot of you, and some of you may have a patient that cannot afford hospital care in private practice, or some of them are too scared to go to hospital because of COVID. So what are the important resources that you need to prepare to be care at home? So the first one is that the patient or the carer must be mentally sound, so they are not confused. They must have a certain level of intelligence to understand what they are doing, especially in monitoring the vital signs and also detecting the symptoms. Second is that they must have gadgets to allow them to monitor. So, and then and maybe you can have this specialized remote patient monitoring, and also the intelligence to use the gadgets. So sometimes if you are not sure how to use the oximeter and you can measure wrongly. Third is that you must have a basic knowledge of your health condition. In this case, the patient has heart failure. So they should know that when you have heart failure, if they are breathless, severe breathless, that is a dangerous sign. And the oxygen saturation, they must be aware that the numbers that is critical. Fourth is looking for the dangerous signs and symptoms. And lastly, immediate support is available if required. So they must know where to go. So these are the minimum prerequisite for caring at home. So what is the benefit to the family and also the government? We can save costs for the family and even the family, even for the government. And healing in your own environment. Reduce infectious disease transmission and raise awareness and empowerment of the patient and family. So a lot of times we have transferred the responsibility of our own care to the doctors. So, and study has shown that if you are responsible and willing to take care of yourself, the outcome is much better. And it also improves doctor and patient relationship because it's a consultative and non-authoritarian relationship. You know, it's not like the doctors tell you, you must do it. So the patient trained to manage their own chronic diseases. So this is a question that I always ask during a healthy aging talk. I want to ask all of you, who is responsible for your own happiness and own health? So a lot of people will say that it's the family is the one responsible, or the community should take care of me, and sometimes they say the government is the one that should be responsible for my health. But the most important stakeholder is yourself. You are the one that must take care of your own health. Okay, so patient empowerment. This is one of the key pillars of chronic disease management. We must encourage and also educate the patient to be responsible for their own health. So patients are the active participant and the partner in care. So in an advanced country like the European or America or Singapore, Hong Kong and Japan, they give a lot of responsibility back to the patient. And patient gain peace of mind knowing their objective health data, and they know that something is wrong when the data change. It's their responsibility to monitor their symptoms and vital signs and engage patient, increase compliance and also improve outcomes. So in Malaysia, the public health concern is ischemic heart disease. It's the #1 cause of death in Malaysia. Chronic diseases like diabetes, high blood pressure and high cholesterol, these are risk factors for ischemic heart disease. And one of the key risk factor is blood pressure. And this is a very important vital sign to monitor for heart disease. So many patients, if they are not empowered, they only see their doctors every 3 months. And their blood pressure may have gone up or gone down. And this is not an ideal situation to prevent ischemic heart disease. And on the chart here, you can see that the 5 principal causes of death. First is ischemic heart disease. Number 2 is pneumonia. And number 3 is stroke. Number 4 is accidents, and followed by cancer. So these are the statistics that we have to look at in Malaysia. And NCD's non-communicative disease is preventable. And you can see here, 1 in 5 Malaysians has diabetes, 3 in 10 Malaysians has high blood pressure, and 4 in 10 Malaysians has high cholesterol. So all these conditions must be monitored closely. So when patients monitor their condition and we equip them with the knowledge of lifestyle change, so if they found that their sugar is high, they are more willing to change their diet. And suddenly, if they found that their blood pressure has shot up, and it could have been because of the diet they have taken. So these are the numbers that allow the patient to be more aware and change the direction of how they manage themselves. And with the arrival of the COVID, the pandemic, this is another vital signs that we have to monitor. And many patients have this condition called silent hypoxia. Their oxygen is low, but they have no symptoms at all. So these are patients with low oxygen, and usually happen in the younger patient because of their higher reserve and higher tolerance. So these are the numbers that is not normally monitored at home before the pandemic. But since the pandemic, more and more of the general public are aware. So at the beginning of the pandemic 2 years ago, when I talk about this, many people are not familiar with it. But now the community will be able to tell you the numbers, and they know how to manage it. Hypertension awareness in Malaysia is low. Only 50% of Malaysians are aware that they have hypertension. And hypertension, as I said earlier, is risk factors for heart disease. And how do we make the diagnosis? So sometimes patients will arrive in a clinic and we take their office clinic-based blood pressure. And this blood pressure sometimes can be wrong because of white coat hypertension. And white coat hypertension can be easily ruled out if they can monitor their blood pressure at home. So if the blood pressure in the clinic is 160 to 170, and the monitoring at home is only 120, this is confirmation that they do not have a real high blood pressure. So this is the slide that I presented earlier, top 10 causes of death in Malaysia. So ideally, today we have seen many of these new innovation and technology from telemedicine and some of these gadgets. So ideal situation is that we can have this integrated physical and digital care. We have a virtual accessibility. You can have access to healthcare workers whenever you need. And you also have a connected community. Those patients with similar condition like heart failure, diabetes, sometimes you can put up your query, and other members may help you to answer. If it's moderated by medical personnel, they may say that, oh, this is wrong comments. So these are socially driven, and it can be done in a safe way. And tailored and data-driven decision can improve the care of the patient. And some of the new research can also be incorporated into the app. So these are the future ideal situation that can change the world, the way how we care for our patient. So some of this data that you can collect, you can transfer to your phone and go to a cloud, and this can be shared to your healthcare worker or to the hospitals, and the aim is to improve the long-term outcome. So just like when you are staying in the hospitals, these are the measurements that nurses do, and now there's technology that allows you to monitor this at home. These are the simple things like temperature, heart rate, blood pressure, oxygen saturation. So the arrival of these gadgets and allow patient to be cared safely at home. So when you are monitoring a patient at home, these are the important things that you have to monitor. First is their symptoms. So there are any signs of anything from head to toe, pain, discharges, the urine, the feces, and the wound, you have to monitor closely. And the vital signs, all these gadgets of measuring BP, pulse, oxygen, and temperature should be tabulated and shown to your doctors. And lastly, for this to work, you should get easily access to your healthcare worker. It could be telemedicine or to a call to your general practitioner. So what are the gadgets to keep at home? The essential one that everyone should have at home is a blood pressure monitor. So it gives you the pulse and the blood pressure. Oximeter also is important for lung infection, heart failure, and glucometer if you have diabetes. So this is a minimal gadgets that you should keep at home. Other gadgets that is important are thermometer, weighing machine. Weighing machine is important if you have heart failure, liver failure, and dialysis. So my heart failure patient, I ask them to weigh themselves every day. If one day their weight have changed 2 kilos, they put on 2 to 3 kilos in one day, that means water are accumulating. So they need to take their diuretics before it gets worse. Urine dipsticks for urine infection, and especially for pregnant ladies. So these are the minimum that everyone should have some spare at home. So these are the visual representation of these gadgets. Blood pressure monitoring, you can have these numbers, thermometer, glucose meter, and pulse oximeter. So pulse oximeter has this two data. One is oxygen, and the second is the pulse. And my sponsors wants me to inform you to note that Malaysia Ministry of Health has this MDA that requires all medical devices in Malaysia to obtain MDA registration before they sell it in Malaysia. And I'm sure you can buy some of these gadgets that come from overseas in Shopee or Lazada. But if they are not recognized by MDA, or you may buy a very cheaper gadgets, but if they are not recognized, sometimes the data that you have collected may be inaccurate. And if it's inaccurate, sometimes it can cause harm. So make sure that you buy gadgets that is registered. Okay, so BP machine. Many of you here are doctors. So I just want to go through briefly how it should be done. So blood pressure should be checked before any meals, and you should check on an empty stomach, no caffeine, no smoking, and not exercising, and not emotional. And some of these patients will inform me that their blood pressure is erratic. It can be high, it can be low, in the same timing. So my advice for this patient is that they should check their blood pressure from 1 to 5 times continuously. And how do you know that the blood pressure is the real blood pressure? I told them to choose the lowest blood pressure. It's not the average, and it's not the highest. You should choose the lowest blood pressure. The reason is because the blood pressure will fluctuate depending on your emotion. So if it's true high blood pressure, it should not go down. So sometimes patient has a high, low, So we choose the lowest as the standard that we define as a blood pressure at that time. And this machine will give you the two numbers. One is the blood pressure and the other one is the pulse. So how do you know that the blood pressure that you measure is a dangerous blood pressure? If the blood pressure systolic is less than 90 with symptoms, so the dangerous symptom, which I will explain later. If your blood pressure is less than 90 and you have no symptom, you feel good, that means the machine may be faulty. So the key is that with symptom. And similarly, if the blood pressure is more than 180 with symptoms like headache, breathless, chest pain, these are dangerous symptoms. You must go to see a doctor as soon as possible. And you should calibrate your machine. So how do you do the calibration? So if you're at home, then we encourage them to measure their family members who are normal. So if your family members have a normal blood pressure and you have a high blood pressure, that means you truly have a high blood pressure. And I always encourage my patient to bring their blood pressure machine to the hospital and we measure together. And if the numbers are quite similar, that means their machine are working. And the next number that is important in this machine is the pulse. So if your pulse is less than 40 and more than 150 at rest with symptoms, these are dangerous signs. They must see a doctor as soon as possible. They should not be staying at home and monitoring themselves. Oximeter, this one I think all of you are very familiar, is dangerous if it's less than 90%. You must call your doctor. And the medicine to keep at home, or you must have a healthy food, clean water, and exercise according to your fitness, adequate sleep, paracetamol, oral rehydration salt, and some of these are first aid things you keep at home. Okay, these are things that I think is important for those who care for elderly at home. They must be familiar with the critical symptom or signs that their patient is not well. First thing is that if a patient is unconscious, unresponsive, no breathing and no pulse, no movement, this one is logical. They must call the hospital. Second thing is that the gadgets that they measure, if the blood pressure is low, less than 90, in combination with a fast heart rate of more than 120 at rest, is dangerous. So this is what I call discordance in the vital signs. So if your blood pressure go lower, the heart will have to work harder to pump blood to the rest of the body. So when you have a low blood pressure with a high heart rate, it's a dangerous sign. And this pattern, I learned it in a hard way when I was training doctor I was in Singapore. So the patient had a serious septicemia, and at that time, my consultant kept asking me, why is the patient's heart rate so fast? At that time, we didn't know the cause of his problem. So that case allowed me to pay attention to the pulse. You know, pulse can be high for many reasons. If you are bleeding, you are dehydrated, if you have a heart attack, if you have severe respiratory failure, the pulse will go high. So that is one of the indication for something serious. So anyone at rest should not have a pulse of more than 120. You know, if you are running, yeah, it can. But if you are resting and your heart rate is more than 120, it's a very dangerous sign. You must look for the reason why your heart rate is so fast. Massive bleeding. If you have a cut, vomiting blood and passing blood through the feces, is a dangerous sign. You must see the doctor as soon as possible. And some patients have suicidal ideation. Also, they must see their counselor or psychiatrist. So the trick of a doctor, which I also sometimes I give talk to the general public, we use pattern recognition. So if a patient has fever and stomach pain, depending on where they are, right upper quadrant, gallstone, appendicitis, middle is pancreatitis, so they will be confused, blood pressure will be low, heart rate will be fast, and sometimes they feel giddy. And if you have fever, stomach pain, and pattern black stool and vomiting, coffee ground, it could be a peptic ulcer. So some of these are the patterns that we look at. So as I said, the serious symptom are bleeding. If it's a minor cut, we just compress it. If it's massive bleeding, you can see it. And fever, infection, and if they have a headache or chest pain. So these are the things that patient has to monitor at home. And if they are not sure of all this finding, they must have direct access to a doctor to check with them of the cause of their problem. Other serious problem, you can see here, breathless. If you are doctors, I think these are very familiar to you. And for serious hypertension, so sometimes some patients present to you with a blood pressure of very high, 180, more than 110. If they are totally asymptomatic, then it's not malignant hypertension. It's called hypertensive urgency. But if they have severe high blood pressure with confusion, headache, stroke, chest pain, and breathlessness, and blood in the urine, then it's a dangerous high blood pressure that they should be admitted to the hospital for management. Okay, these are signs of pneumonia, which I think most of you are familiar. But I want to make you aware that for old people or immunocompromised patients like HIV, diabetes on chemo, and hematological patients may not have the classic symptom of fever, sore throat, and cough. Sometimes they may have breathlessness, chest pain, and blackout. And these are the dangerous signs. The blood pressure is low and the heart rate is fast at rest, and the saturation is less than 90%. So these are critical signs they have to watch out. So these are some of the symptom recognition that they have to be aware of. If they have a heart attack, they have chest pain, breathless, palpitation. These are minor symptoms, but in combination of giddiness, blacking out, cold sweat, and nausea, it could be signs of heart attack that have to go to the hospital as soon as possible. And those patients with heart failure, the case I presented earlier, his symptoms are cough, breathlessness because of water in the lungs, abdominal swelling, and the legs are swollen. So this family are very caring, and they are very sensitive to the changes, and they came to me before it became worse. And so other serious symptoms for the common top 10 causes of death in Malaysia is stroke. So if they have severe headache, sudden giddiness, sudden confusion, and blur vision, face distortion, and speech disturbance, they have to see a doctor for acute stroke. So acute stroke must see a neurologist as soon as possible because it can be treated. These are some of the signs of stroke. Half of the body is numb or half of the body is weak. And mental issue must be also monitored. Sometimes the pandemic caused people to feel lonely, stressed, and depressed, and also will lead to suicidal ideation. And these are some of the numbers that they can call. And for those who care for old patients at home, you must watch out for blood clots in the legs that can travel to the lungs and kill them. The reason is because of lack of mobility, and the signs is that it has a swollen legs. It can be very painful, and if it's red color and tender, it may not be a blood clot. It could be a serious infection of the limb. And symptoms are breathlessness, the blood pressure will be low, pulse will be fast, and they may have a fever. So the pattern here that I keep talking about is the discordance of the low blood pressure and high pulse. Patient with diabetes will have a thirst and frequent urination, fatigue, and losing weight, and it's easily diagnosed by a fasting sugar level. And those with diabetes, sometimes they get hypoglycemia and they become unconscious. It looks like a stroke. So we look at a stroke, always check for sugar, and they can be having seizure. Okay, so the digital transformation of healthcare, they can do this. This is a term that you can Google. It's called remote patient monitoring. So what they do is that it uses information technology to gather patient data and share their health condition and home monitoring record to the healthcare professional via the digital platforms. So this vital sign information allows the healthcare professional to make accurate assessment. So this is a future trend which my sponsor want me to inform you. So you monitor the vital signs. You monitor and you record. So instead of using manual record, you can use a digital record and observe, understand your average reading. So you know your constant reading, and suddenly you have a higher or lower reading, something is wrong. So because sometimes, especially older patients, they have no symptom. It's only the vital signs and give you a suspicion that something is wrong. And the action is you have to do something when you find the variance from the average reading. So what is normal parameters? So normal parameters is equilibrium. It's not too high and not too low. Okay, so I think this one I have talked about it already. Our pulse should be from 40 to 100. Anything below 40 or more than 100 at rest, something is wrong. And ideal blood pressure is 120/80. If the blood pressure is too high, associated with symptom, is something dangerous. And then respiratory rate is the speed of you breathing. If you have a serious lung problem or like infection, pneumonia, or heart failure, your respiratory rate will be more than 20. And temperature is important for infection. Okay, saturation. This is, I think most of you are aware, if your saturation is below 90%, even without symptom, it can be a dangerous sign. And blood sugar, you can monitor at home. And so if you are a patient that monitor their sugar regularly, they will be more compliant to their medication, and they will be more compliant to their lifestyle change. So self-monitoring is a behavior that's encouraged in your patient. Sometimes you see patient coming in with all their records. So you don't get angry with this type of patient because they really care for their health. Some doctors will be very upset. They say, I know what I'm doing. You don't have to show me these numbers. So it's encouraged that they monitor their own condition. So the importance of health monitoring, patient can take immediate action to any unforeseen health issue. And healthcare professional can make their assessment on treatment efficiency by referring to the patient's day-to-day vital signs. So it's good to see their record and know what is going on with their care. It's not a 3-month follow-up, single point care. You must see the trend. And home monitoring is part of the remote patient monitoring, which is a new option to seek for medical consultation under the new normal. I'm sure when our country has go back to the normal practice, all of you would prefer to have Zoom meeting rather than go to a face-to-face meeting, because it's convenient, it's safe, and also it has the same function. So when the new normal come, we have to change our strategy. Otherwise, we'll be left behind. So just a reminder, to care for patient at home, you must have a smart patient and family members. You must have the gadgets. You must have a basic knowledge of your own health condition, and you must know what are the dangerous signs or symptoms that you must recognize, and immediate support is available if required. So these are the key prerequisites for home care. And this is my final slide. Users must be familiar with the device to ensure accuracy. User must seek healthcare provider for abnormal readings. Health monitoring for home helps with early detection and a normal health condition. Okay. Thanks for your attention. If you have any questions, you can ask me for the next 5 minutes. Dr. Arasu, your mic.
We can take a couple of questions. Do you have any questions from the floor? You can raise your hand.
If no question, I would want to elaborate. In a Western country, they have this program called chronic disease management. I think in Malaysia, there are a few initiatives in the government hospital dealing with heart failure in Sabah. So chronic disease management is that they educate the patient and empower the patient to monitor their own condition. So for example, for patients with heart failure, they measure their weight, they monitor their symptoms and also their vital signs. If they notice that they are accumulating water, then they are instructed to take diuretics. So that is done in this setting called chronic disease management. And if they are not familiar or they are worried, they have a number to call. So the person that they call is not the cardiologist, not the specialist. They call the nurse clinician. So this nurse clinician is like a nurse manager who is in charge of a number of patients. So if there's anything, they will call the nurse manager, so that they can be managed at home to stop them from coming to hospital. And also, if they have a serious condition, and the nurse manager can detect it through the phone, and they can be sent to the hospital earlier to be treated using IV drugs. So these are some of the examples that can improve the care of patients. Yeah.
Thank you again, Dr. Wong. I think if there's no more question, I think we should give a round of applause to Dr. Wong
Thank you.
for reminding us that hospital-like monitoring has taken place, is the way in the future, and we all should embrace and empower patients. Thank you.